you've got to be cautious about not rushing the technology for doing good. I am for AI in healthcare, but in the right way. Let's do our homework. Let's take our time, push it at the right pace, and use it in our arena and do better for our patients and enjoy it too.
Hey everyone, and welcome back to the Tech Seeking Human podcast. And this is episode 2 of the interview that we did with Dr. Zain Khalpey. If you listened to episode 1, then you know what's coming for episode 2, and you're grossly excited about it because this is one of my favorite podcasts that I've ever done, along with Ellie. And in this particular episode, we're going to focus in on actually one of my passions, which is how you can take health data, wearable data, and use that to potentially understand any risks associated with having a heart attack, or basically use it for like preemptive care, but also use it as part of like a surgeon being able to analyze it. It's actually really interesting. So I'm wearing an Apple Watch Ultra, I'm wearing an Oura Ring, and I'm wearing a Whoop band. And for anyone that's listening, I just pointed to all of these devices. I wear them all at the same time and I analyze the data, and I love it. Heart rate variability, sleep data, resting heart rate, all of this sort of data I love to analyze. But if you listen to the end of the episode, you'll hear me share with Zain that I'm really worried about my heart rate variability. I know it's unique to me, but I seem to be really, really low in comparison to the rest of the community. And he said, Dave, go get these scans done, an ECG and a few other tests done. Then send me all of your Whoop data, all of your HRV data, all of this information. Send it all to me and I'll analyze it all. Part of the conversation we have in this episode, aside from like a leading heart surgeon that is going to take the time within 12 hours to come back to me on the result, it's like mind-blowingly amazing. But how is that going to scale? How do we get data and extract it from all of these devices? Who owns these ecosystems, and how do we make it available to healthcare providers? You'll also hear about Ellie opening up about melanoma, and this is a ripe opportunity for an AI to be doing work on mole mapping and to be able to prevent skin cancers, which is a leading cause of death. And you can hear in this episode in Ellie's voice how concerned she is, and most Australians are, and people all around the world are, about skin cancer. And interesting at the very end also, whilst I didn't have this news whilst I was recording the episode, in between recording the opening to this right now, I made a decision to move back to Boston. And Zain said, oh, it would be so good for our families to one day sit down and meet. And his message when I announced on LinkedIn that I was moving to the US for work reasons for a few years, the very first message I got was from Zain saying, finally, our families get to meet. So I'm really excited to share with you episode 2. Enough hearing from me. Let's get straight into the episode. It's a great one. Pi AI is what this AI is called that's helping improve decision-making amongst teams. And you're working on it now. You said it's going to be out soon.
So Kai AI, or Kai, is Khalpey AI. It just was created in our lab by my wife. And long story short, in the operating room, we've got Kai OR, and on our website, it's just literally a generative AI chat GPT engine, which we trained from the GPT store. You can go on to our website and it will ask you to, like I send my patients there and say, look, this is not a branded thing. This is a personal thing. But I've trained it to tell you about the diets that I would prescribe in terms of a Mediterranean diet before the surgery, because it's anti-inflammatory. Why don't you go there and ask yourself questions instead of our office getting loaded with calls? And what we've done is we've actually screened and got similar questions that we have, and we have answers already trained with the GPT engine called Kai. And we're seeing how people respond to that. So I thought, let me just save myself time and headache by answering the same question all the time, by actually making it a little bit more formulaic and creating, this Kai GPT engine. So we've got one for patients, we've got one for clinicians, and we've got one for researchers. And it's on the website. And so there's things like that. And Kai is this kind of LLM, if you like, with these agents, which create the super agent. So
So we can learn more on your website?
Yeah. Khalpey-AI, yeah.
Your wife developed this, I heard you say?
On a Sunday morning, yeah. She's a plasma physicist. She's a plasma physicist. I still don't know what that means. But she's French, and I met her at a conference, and she's an amazing human being, and literally the shoulders I stand on to be who I am. And I can apply the AI, but she is the brains. And I know how to apply it. And we're actually coming out with this book called The AI Prescription, which Nick and Ben and Cassie Kozakov will probably be part of. And it's called The AI Prescription. So she said, well, let's just talk about AI literacy. And we're putting on a course over here, because I think from leadership all the way down to physicians, doctors, nurses, and medical assistants need to be familiar with how AI works. And she's written that, and I helped her with clinical vignettes to give it a little bit more real world. And Ben and Nick are doing the data science and part of it to the translation. And, like when Nick came to the operating room, I don't know what he sees, but I know what I see. But then when he talks to me, I've learned so much from what he said about how I can improve and how I can change things, or how things fit in his world and how he uses the rubric. And I thought, how about if I use and give you my Lego pieces from my rubric? How does that work? That's how we can fuse things into something that'll be really cool. And everybody has to talk to each other.
Yeah, that's so cool. We've taken up so much of your time, and I'm so inspired. I think if your kids were to nominate for the equivalent of an NBA draft, most recruits would probably be looking at the stock and obviously how smart yourself and your wife are, and obviously the environment in which they're growing up in is superb. It's super inspiring. But I've got some selfish questions, really practical, because we discussed a long time ago the impact of things like heart rate variability. And I'm covered in, Ellie gets sick of me talking about this, but I have an Oura ring.
You have so many.
A Whoop band. I don't even have my Apple Watch. I only have my Taylor Swift wristband now. I'm obsessed by the data that comes from all these wearables. And I take them out, I chart them, I look at them. I suffer from really low heart rate variability, and I'm told, it doesn't matter. It's all variable depending on who the person is. But I really look at my recovery. And this is a selfish question because now we have a world-renowned heart surgeon on a podcast, but practically speaking, how important are these wearables? And what's heart rate variability? Are you looking at these preemptive signals in order to help people understand how they can improve their health? And can they make a difference? The other one massive question, which might get us into trouble, Apple did a huge campaign about how they save lives using an Apple Watch. Is this real? Or is it a bit of marketing hype?
I'll give you answers to all of that. So I think wearables are the future. I think they can be more intelligent than what they are right now. The Oura Ring is cool in a way, the position of it, and I think that's the future of it, which is why Samsung came out with their ring, and Apple will probably come out with a ring to cannibalize the Apple Watch, who knows, or complement. But that's one. Number two, I think the tech is going to get smarter but more synchronized into ecosystems. So if Apple come up with their own ecosystem, that's great. I think that Samsung and Google may come up with their own. And I think these big tech's going to do that. But I think it's what worries me is big data, right? And how it influences the way we think. And that affects what I'm thinking about I'm more of a decentralizing guy, and I'm a Bitcoin guy, and I believe in all of that and Web3. But I think that we are going to have problems with data that's going to be, you'd be a fool to think that they don't own the data already about you. And so that ship us out. So forget about it. Microsoft knows what's your emails, and Apple, they shroud themselves in privacy but it's great marketing. To answer your heart rate variability question, we have a device that it's non-invasive, and I put it on in patients, and it's called Vital Stream, and it's from Caretaker Medical. And I've now changing cardiac surgery in my patients by not having invasive monitoring, because I think this is just as good, and we're building the tech in that to actually make predictive analytics. So in that, we look at heart rate variability, just one slice, one little piece, one little Lego block in a big puzzle. And so I'm trying to contextualize it for you, Dave, that HRV is referential to, or the delta in there is your reference point. It's not anyone else's reference point. It's your reference point, because that's your, so if your heart rate variability changes by 2 or 3, even if it's low, it's the delta of the frequency of the high frequency to the low frequency that matters, because that can lead to predictions, and it could just be you. It's a signature of your autonomic function. And so that means your breathing is autonomous, your heart beats autonomous, you breathe 23,000 times a day, your heart beats 90 to 100,000 times a day. That's your autonomic nervous system. And the heart rate variability tells you a little bit about that. So yes, diabetes affects that. Heart failure affects that. Can it lead to predictive analytics? I think not on its own. It has to be coupled with other things. So we see that in the operating room. You've got to be contextual about what you're seeing in context to the activity. So having function coupled with HRV as a static idea gives you, like, say, for example, VO2 max, right? If your VO2 max is fantastic while you're exercising, your heart rate variability is just another parameter, but you have to look at the trend. And so when it comes to Apple, their study, for example, predicting atrial fibrillation, was done in people below 65. And my wife was the first one to tell me about heart rate variability. I didn't have a clue. She said 5 years ago that the Apple study is a pile of crap. And it was relevant for those people who are below 65, but anybody above or younger than their cutoff range, it had no relevance in terms of accuracy, but they claimed that it was FDA approved. And so I am concerned that there's a lot of marketing tricks that are played from studies done at big named institutions, which aren't validated enough, or may have been in the past at that standard, but we have a new standard and we're going to call them out. So what about the patient who had a stroke and didn't say anything about atrial fibrillation? Why not? What about all of those cases? It's concerning that that's what industry is doing, only to get market share. I think that those devices and the fidelity of those devices are phenomenal. However, open it up. Make it open source. Make us all make it better. And, what's so proprietary about it? Because you'll get sued by Massimo again. So, there's a green light that you can use, which has been out in Samsung or any Droid devices, that actually non-invasively tells you real-time blood glucose monitoring. That's going to come out in one of these big tech companies. And one has to be very mindful of that data being better than a real-time, little glucose monitor that you have continuously looking at your capillaries. And how do you validate? How do you make it more accurate? How do you believe it? Can you trust it? And so for me, I still feel that wearables hasn't reached the trust point yet for making a medical decision on a patient. So when they came and they told me, oh, my Apple Watch told me I was in atrial fibrillation, I'll go, oh, okay, let's have a look. And it's just a 2-lead EKG or single lead EKG. So the fidelity on that is poor, but the graphics on it look cool.
That's a big thing to unpack. I think if I summarize, what I would be really keen to understand then is, with more people wearing Apple Watches, you might get someone say, I just had this one thing, but do you look at, you talked about trends. It's important to see trends over a period of time. So if someone had a Whoop band or an Oral Ring or an Apple Watch and they came in and they had the data available, would that be something that would be of interest to you over a longer period of time, or would you run your own testing anyway?
Both. I think, a guy who I really like is Peter Diamandis, who's created this company called Fountain Life. And what he does is he's got this cool idea of looking at longevity, right? And he's looking at wearables, he's looking at all the wearable data. And then he does brain CT scans, chest CT scans, looking at soft plaque, putting that all together, looking at inflammatory burden, looking at the omic level, putting that all together, about 200 gigabytes or 150 gigabytes worth of data. But who owns that data, right? But that's another conversation, which I won't unpack now. But I think that, do we trust that data and put it into context of what's happening with a patient? Yes, but it's not true fidelity. If a patient's coming in with a problem, you have a signature of a pathology, which is digital, which you can then assign or label appropriately. So garbage in, garbage out. If you are just labeling, a happy businessman coming in for his 1-year check, great. So what? Doesn't tell me anything. Oh, you've got a bit of heartburn. All right. But if it's somebody who's got real pathology that's in a hospital, that's like, you've got, this is my lab, right? You are able to learn, validate. This is the problem with big industry is you have a pacemaker. You can tell when the heart's going at a funny rate. You're able to defibrillate it if it goes into ventricular tachycardia. It sits inside the patient. But they have no clinical context of where the patient is. They have no idea what medications they're on. They have no color. They see black and white. We see technicolor. So all I'm trying to say is data needs to be guarded. It also has to be colored. It has to be contextual in order to give you the clinical story that means that it's bona fide and valid for it to mean something in the context in which you're looking at it. So in terms of diagnoses or in terms of prediction.
In a perfect world, which we don't live in, wouldn't it be spectacular to have an open ecosystem where we could run analysis of data, understand more about people without understanding the individual? So you could look at HRV trends that led to heart attacks. If you had access to this data, I'm saying Apple is sitting on a goldmine of data, right? If it was more open source and people get more access to it, couldn't we prevent more deaths and illnesses by collectively learning? And I know that's a perfect world because in a medical society, no one's giving up access to all of their data for obvious reasons. But if we could, wouldn't the benefits outweigh the risks?
100%. There's good Samaritan and humanitarian approaches, and very noble, physicians have thought about creating these databases, and they have, and they've made them open source. Look at the Mimics-3 database. That's got just waveforms, which you can, use, but it has no true context. The fidelity of the waveforms is not great. You only have a certain slice of the thing. Everybody's tried to put these together. Nobody's created a true ecosystem like you're describing to have context. Many societies have created, in cardiac surgery, the Society of Thoracic Surgery databases, which has, 1,000 parameters per patient before surgery, the phenotype, what happened during surgery, the outcomes, the complications, and putting it all together. And everybody is well-intentioned to try to get to learn that, but it's not in real time. So they're all retrospective. If we can make a real-time processing engine, which we are trying to do, then we will be able to make real-time decisions, better decisions, as a tool to recommend to the physician to reduce your mistakes. So this is what I'm hoping Kai will be, frankly, and put it into context. And also, it would be the engine that would allow us to diagnose and predict and prevent.
Are you optimistic about where we're going with AI?
I'm reservedly optimistic because I think that there's a lot of charlatans out there. I think every industry phenotype is slapping the AI label to make it look cool. So I think there's a lot of fake AI in healthcare, unbonafide, untested, unvalidated, AI enabled, bunch of bollocks that are out there. But I think so I'm the chair of the AI governance committee at my hospital network, and I'm the chief medical AI officer. And what we do is we are building a risk assessment tool for various categories of risk to the point where we can vet and do people who bring AI to our table, ask them to do a lot of the heavy lifting. We're validating Databricks this morning because of our whole ecosystem. We were looking at Google. We're looking at Microsoft. Microsoft Fabric hasn't even got there yet. Google's got Vertex, which is brilliant, but still far away from applying it in the real world. And we're in the real world. So am I positive? Yes. Am I reserved? Yes. Am I trying to weed out the nonsense? Yes. Have we got a long way to go? Yes. It's not going to happen so easily in healthcare as it is in, say, the energy sector, because frankly, lives are at stake, and that's more valuable. And the human in the loop story has to be front and center in healthcare. Otherwise, we will not be able to push AI responsibly or ethically with true transparency and governance. And then you can't build trust, and so nobody will adopt it. So we're at a very critical time because you can't just have any, Tom, Dick, and Harry do this. All big industries can't push for the wrong reasons, just like, argumentatively, the vaccine. 99 million people were tested, and there was a 2 to 3 times more increase in cardiac pericarditis. So, you've got to be cautious about not rushing the technology for doing good. So I am absolutely 100% for AI in healthcare, but in the right way. Let's do our homework. Let's take our time and not, suffocate it like the FDA for HIV drugs, but push it at the right pace. And the Europeans are doing it the right way with the AI Act, I think. And we can learn something from that and use it in our arena and enjoy it too. So, and do better for our patients.
I asked Nick a question around the concerns of people taking advantage of the data. And by that, I probably mean more like insurance companies than anyone else. And I asked that because I have had 2 melanomas removed, and I was kind of warned against any genetic testing because my doctors believe that I probably have some genetic disposition to have melanomas, and therefore if I do that, I don't get covered by insurance. Is there like a concern, or how do you think we can mitigate against big insurance companies coming in and using this kind of data as predictive analysis to then justify not covering people if they're showing markers that maybe they're going to lead to something in the future? Do you have a point of view on that?
It brings it home when you say you had melanoma. And so I hope you're doing okay.
My grandparents both died of it. So I've grown up and acutely aware of the fact that melanoma is very much probably in my system. So I've been very lucky, I think, and fortunate to know what to look for. And so I was been very, very quick. One was an in situ, but the second was a level 2, which was a little more concerning. So I have the good fortune of being very aware of it. Yeah, I'm doing fine. It's just a bit concerning when I'm only 34 and I've already had 2. So the likelihood of me getting more is very high.
Surveillance is important, and we'll help you in any way we can. To answer your question, I think that it's all about the right data. I'm a half glass full guy. I try to think that people are honest and do things at face value. I accept people at face value, which makes my life a little simpler and easier to deal with than rather think that there's conspiracy theory. However, I have been on several calls to appeal from insurance agencies about why a certain procedure that I'm not doing is not approved by that company. especially in the US, when the other company does it very nicely. And it just could be the amount of data or conscience. It's not about the conscience, I think. It's about the data that they have that they're basing the decision on, which is incorrect. And I think it's us as good stewards of, what we do in our professions to educate them. Almost all of those calls turn out to be okay. And if you tell them why and you give them the evidence for it. So I want to, say that they are helpful, but there's also a lot of dodginess that goes on with people who take advantage of that system. And unlike you have a true pathology and a true background, is there a bias? There's always going to be a bias in whatever we do. And you can choose the type of flavor of bias you want. But does that impact you negatively? I'm sure it would. And I think that the insurance agencies, whether you get sniffed out with an AI algorithm or whether you get sniffed out because of the human factor with a bias, then yes, there will be. But there should be provisions for people who have a genetic predisposition to have their procedures covered. And so I think that's for us to navigate in clear waters so that you can be taken care of, especially if you pay your premiums. And so, what's fair? So I think that, I waive my fees. I had a jockey who used to be tiny little guy who's phenomenal, and he needed heart surgery. And I said, what do you do? He says, I don't have insurance. I just have the basic. And so I dropped my fees because why should I? Don't need it. And he was in tears. And I think that we appealed for the things that I wanted to do for him, and we did it. And so we got through, and we had a patient who was really happy. But you've got to sometimes fight this with a sharp scalpel and outsmart the stupidity of the bias of the people who are behind it. And I think you can do that argumentatively. So I think that you can still win. And we did. And he's doing great. And now his boss came to see me today because he needs heart surgery. So it's fun. And he's got insurance and a different insurance agency.
I was going to ask.
It's like, great. It's like, and he works in a barn and he loves racehorses. So it was fun to have them here. And that's why this story came to light, because I just saw him today in my clinic. But I think, you will have bias all the time, and that exists everywhere. And I think that is something we've got to work and untangle that Gordian knot, which insurance companies have this, dark shroud of what they believe or what we perceive them to believe, which may not necessarily be true, because I've had many decisions overturned only because my note was crap and didn't mention the predisposition conditions which would have made them eligible to have the procedure. So I messed up. And so it turned out to be okay.
You've been unbelievably generous with your time.
No, and it's been fun. I've had a good time.
Oh, that's so good. Is there anything we didn't cover? Is there anything that you really wanted to say or talk about that we didn't touch on?
No, I think it's been a fun podcast, and I think it's been great to speak to you more than just 10 minutes, Dave, and lovely to meet you, Ellie.
Lovely to meet
honestly,
you.
I hope I get to meet you guys in person, and you have an unconditional invitation to Arizona. And I hope you get to meet my wife and the family, and I hope you bring your families too.
I've been trying to get over there for a little while. I got to, it's not far from Utah, and I've got some friends I need to go there during ski season, and I'll try and make my way over. You're just a remarkable guy. Ellie, I was going to do an intro to the podcast to say someone that operates on more than 400 people a year, and my intro to Zain was he's one of the leading heart surgeons in the world who is noted for saving a professional ice hockey player's life who practically died on the rink, and there was a documentary on it, and I sat and watched it, and my wife and I were just like, you're unbelievable.
In summary, and I've written it down and actually scribbled, underlined it, is that I actually think you're one of the world's best leaders. because it's more, you're talking more about what you do as a clinician. You're talking more about how you have your team around you and how you have built this wonderful capability amongst everyone, that I actually would really say that you are a brilliant leader.
Well, I always believe that, just like children, you always want them to do better than you, right? You want your kids to be better than you. You want them to have an easier life than you. It's a simple philosophy about people in your life. And whether it's your team, I definitely am a hard taskmaster because I expect a certain standard from my children and from myself. And if I can't perform or do that, then my expectations would be, and you're human, you make mistakes and you have to accept that. And as long as you fail safely and forwardly, you will always do something that's, you have to be gracious in failure, and you've got to learn from that. And I think you have to be not an idiot, but humble about what you do. And I've learned all of that from my parents, and a lot from my wife. And so it's been humbling to be exposed to that every day. And you realize what goes through in one's life, and you think, oh, my day wasn't that bad.
I was going to ask where you learnt it from, but you have a knack of answering questions in the way you tell stories. Can I just ask you one thing? Like, if I'm in like the 1% of HRV, like if it's like really, really low and they have it out, should I be worried about this?
So I'll tell you what, send me your HRV trend, number one.
Okay.
From both your Oura ring and your Whoop band. And, your family, for God's sake, Dave, just send it to me. And then send me whatever medical reports you have. I mean, for God's sake. And if you get an ultrasound of your heart or an EKG, 12-lead EKG from your GP or your primary care, just send it to me, Dave. For God's sake, right. That's why I'm here.
I'm doing it because I'm doing it because my dad had a massive heart attack. I think I told you this a long time ago.
Yeah, I remember you told me that.
And he survived only because he saw an ad on TV that said, if you have these symptoms, call an ambulance now. And the ambulance was there within 3 minutes, which is unheard of. And the heart surgeon said if it was 10 minutes, you wouldn't have made it. And he made it.
So it's imperative that you send it to me, and within 12 hours, I'll call you back.
You're on, because I also, when I was at university, I had a weird P wave. They said you have some weird, I don't even know what a P wave is, actually. You probably will. But anyway, let's just get the data. And I had an insurance company wouldn't insure me for reasons that they wouldn't tell me. And my doctor went, you've had all the bloods. You look normal to me. And they didn't do any ECG when they did my insurance. So I'm going to go get an ECG and I'm going to follow up.
I will insist upon it.
Okay. You're on. You're an absolute legend, my friend.
Cheers there, Dave. And Ellie, what a pleasure to meet you. And thank you for sharing your story too. It was very, very touching.
Yeah. Thank you so much for your time. I'm truly, truly privileged.
Talk to you soon, Zain.
Thanks, guys. Bye-bye.